Welcome to the Pennsylvania Recovery Organizations Alliance's presentation on organizations working together. We at the Alliance have a vision of building a statewide network of individuals concerned about addiction and committed to recovery community organizations, advocacy groups, family groups, and drug and alcohol system entities, all united in a common purpose. However, we recognize that sometimes organizations encounter challenges in working together, even toward what is perceived as a common goal. The purpose of this presentation is to explore the various ways organizations can work together to achieve goals that benefit all stakeholders involved. As you consider the goals that many organizations have in common, think also about the differences that sometimes keep organizations from working together effectively towards reaching goals and achieving objectives. Those differences can range from something relatively small, like on whose turf shall we meet, or who chairs a meeting, all the way to major issues like whether we should have medicated assisted treatment as part of recovery, or on even whether we should have different pathways to recovery. This presentation is designed to help organizations with common goals to develop appropriate strategies for working together, no matter what challenges they face. Organizations that advocate for those affected by alcohol and other drug addictions cannot exist in a vacuum. So the time will come when your organization will need to work with other organizations to achieve goals. The structure of that working relationship can take one of several forms, including networking, coordination, cooperation, collaboration, and multi-sector collaboration. We will explore each of those in this presentation. One of our organizing principles at the Alliance is to build a network of communication and support to strengthen capacity of new and existing recovery organizations throughout the state. We believe, at the very least, organizations should have networking relationships wherein they can exchange information in order to help each other do a better job. Networking requires the least amount of commitment and time from organizations and can, in and of itself, have significant positive results. Networking can involve something as simple as meeting together for lunch, sharing newsletters, participating in email networks, or meeting at seminars and conferences. And networking can be a good starting point for people and organizations to work together in other ways. Another means for organizations to work together is through coordination. Coordination takes more time and commitment than networking. Organizations have a coordinating relationship or develop a coordinating relationship when they modify their activities so that together they provide better services to their constituents. Coordination helps fill in the gaps and also helps prevent service duplication. A gap in services often result in dire circumstances for individuals in addiction seeking recovery and for individuals seeking services to help maintain recovery. Coordination is important because it gives people a better chance to get the services they need. A coordinating relationship requires more organizational involvement, time, and trust than a networking relationship. However, the results can significantly improve people's lives. A deeper involvement between organizations occurs through cooperative relationships. When organizations develop cooperative relationships, they not only share information and make adjustments in their services, they share resources to help each other do a better job. Organizations may share staff, volunteers, expertise, space, funds, and other resources. Cooperation requires more trust and a greater involvement in time than either networking or coordination. In order to enter into a cooperative relationship, organizations also have to let go of some turf issues. Organizations have to be willing to share the ownership and the responsibility, to risk some hassles and reap the rewards of their efforts together. While a key component of cooperation is sharing, collaboration goes far beyond sharing. In a collaborative relationship, organizations help each other expand or enhance their capacities to do their jobs. People begin to see each other as partners rather than competitors. And each organization must also carry its share of the responsibilities. In a collaborative effort, all of the organizations can and should share the credit and recognition. Collaboration is a much bigger enterprise than networking, coordination, and cooperation, but the potential for change can also be greater. It implies a much higher level of trust, risk-taking, sharing of turf, and commitment. Collaboration can give people hope because it demonstrates that people from different groups can overcome their mistrust and other obstacles to accomplish larger goals together. People who benefit from collaborative efforts oftentimes can be encouraged just by seeing organizations working collaboratively. A more complex form of collaboration involves multi-sector collaboration. In multi-sector collaboration, private, public, and nonprofit organizations from different parts of the community, and sometimes ordinary citizens, form a partnership to solve systemic problems in a community. Complex and intertwined problems like these require collaboration throughout a community in order to make positive changes. It requires that all the parties involved put aside the narrow interests of their own organizations or sectors and give priority to the broader common good of the larger community. Everyone involved must come to the recognition that only when the larger community solves its key problems will each organization have a better chance at getting its needs met. In the recovery field, we often conduct needs assessments to determine what's lacking in terms of recovery services. This is necessary so that we can determine how to best spend our time and resources. Of equal importance is to determine the strength of a community through assets assessments and asset mapping. Reaching out to others who serve the recovery community in any capacity helps begin the process of forging new relationships. These new relationships don't always involve those who are directly involved with delivering recovery services or recovery technical assistance to recovery community organizations. It sometimes involves reaching out to the medical field, even out to insurance companies and others who can work together to improve things for those who are seeking recovery from addiction and those who are seeking to maintain their recoveries. So, how do we choose among the most appropriate relationship between organizations so that organizations can work together? Well, there is no set formula for how to go about determining which organizational relationship would best serve a particular purpose, would best serve the organization seeking to work together toward common goals. However, as your organization goes through the process of choosing an appropriate organizational relationship with others, consider these factors. What does each organization want to accomplish by working together? That is, what are the common goals? Which kind of organization relationship is necessary to accomplish those goals? Are there resources available for this kind of organizational relationship, such as time, skills, financial resources? Is there community support, commitment? Are there human resources available? And if not, can those resources be accessed? And are they best accessed by organizations working together? Also, you have to take a look at whether there is sufficient trust and commitment to support this kind of relationship. Networking, coordination, cooperation, collaboration, and multi-sector collaboration are all very different relationships that accomplish different objectives and require different levels of human resources, trust, skills, time, and financial resources. You can always build organizational relationships one step at a time by beginning working together in ways that are less formal and require less commitment. If the results are positive, then the different groups may have built up some trust that will help you take on a greater challenge. As much as organizations have the desire to work together, these endeavors don't always go smoothly for a number of reasons. Let's take a look at some of these challenges that can actually become barriers if we're not careful. People sometimes believe that individual effort is more beneficial than cooperation. They are sometimes mistrustful. People sometimes don't have the necessary communication skills for working together. Racism and other forms of discrimination can keep people and organizations isolated from each other. A lack of strong leadership can hinder the formation and continuation of successful group interrelationships. People may internalize a sense of powerlessness that makes them unable to take initiative to form working relationships. When any of these factors are present, leaders may believe that the challenges are too formidable to work on forging relationships. However, circumstances may make that particular choice too costly. For example, private and public funders sometimes require organizations to collaborate in order to receive funds. And most important, those needing recovery services might not receive all that they need to maintain recovery. One of the most effective strategies for resolving conflicts between or among organizations that must work together is consensus building. Pro A invites you to join us at a future presentation on how to build consensus among organizations, especially under circumstances where conflicts exist among leaders. Our mission at the Pennsylvania Recovery Organizations Alliance is to mobilize, educate, and advocate in order to eliminate the stigma and discrimination towards those affected by alcohol and other drug addiction, to ensure hope, health, and justice for individuals, families, and those in recovery. To build a strong statewide advocacy for drug and alcohol programs, it's necessary for organizations, agencies, and individuals to work together even when the pathways to a common goal may differ. We at the Alliance hope that this presentation is helpful in building coalitions to achieve those common goals. For more information about the Pennsylvania Recovery Organizations Alliance and about drug and alcohol addiction recovery efforts, please visit our website at www.proa.org. We thank you for joining us for this presentation.